Welcome back. ETMC Tyler recently installed the first digital PET CT in Texas, and here to tell us about this new technology is Chris Hall. Hello.
Hi, thanks for having me.
Yeah, definitely happy to have you. Okay, so tell us, what is the PET CT for those who don't know what this piece of equipment is or technology?
So basically, you know, a PET scanner, anyone that's had any kind of family member that's had cancer has probably dealt with a PET scan before. Doctors are typically going to order a PET scan on someone that already knows they have cancer, but they send them to us to further diagnose where in the body that cancer's at. That way they can use that information to stage the disease and evaluate if they need any kind of like surgery, what kind of treatment they want to do. And we'll see those patients throughout their whole course of treatment, basically from the get-go, the initial staging, to all the way through to any kind of basically post-surgery to evaluate again if they're going to need any further treatment down the road.
And so you've had this piece of imaging equipment for a while, but what's new about it is the digital aspect. So kind of explain that then.
So we've been performing PET CT at ETMC for about 15 years now. We've had a couple different iterations of cameras as technologies increased, but this is the first digital PET scanner that's been available out there. With this here, the digital PET scanner is going to give several advantages to it. One of them is basically we're able to do the test about 10 times faster. Excuse me,
faster,
10 times faster than we were in the past. So for patients that are in pain and we need to be able to get them in and out of that camera a whole lot quicker than the 30 to 45 minute scan times that we were seeing in the past. Also, we're able to cut the dose down by half as far as the radiation that a patient receives on the CT side and the PET dose side of this. So that's a huge thing. We're really committed to that at ETMC as far as lowering that dose that patients receive through any kind of imaging procedure.
Well, when you talk about it cuts the time, because I know with an MRI they're almost kind of stuck in a tube. So how does this work for the patient with this imaging?
So that's true. So in the past, even a PET scanner was kind of a long tunnel. It was tighter. With a digital technology, you're taking out all the analog components of the camera that would also increase the noise in the image and replacing those with digital detectors. So the tunnel itself is less of a tunnel and more of a donut, kind of like a CAT scan would be. So it's bigger for the patient. It's a whole lot shorter, so they're not really even in the tunnel that long.
So who do you recommend really gets this then?
Any one of our patients that are coming through that have cancer, this is going to be very beneficial to them. And that's kind of the course of treatment it has been. But, we like to offer this to where, patients that come to see us are going to get the best quality scan because we're able to detect smaller lesions than what were available on the prior generations of camera. And we're able to do that faster with less dose.
And it's so detailed now, I'm sure, too, that image.
The images are very detailed, and that's allowing us to also enter other fields, be it neurology or cardiology, that we're able to do on this camera, and provide just that much more information that's going to help the doctor that use that information to get the best treatment possible for that patient.
Okay, sounds good. Thank you so much, Chris. Appreciate it.
Thanks for having me.